Tom, and in this little series of videos we are going to be talking about how back pain is all in your head. Now to explain that I have to sort of maybe put it into context. Now when we get back pain, there may well be muscular tension, there may well be knots in our muscles, there may well be a lack of range of movement at a joint. Now if we have trigger points or knots in our muscles, what we have to do first is we have to restore the muscle back to some sort of normality, I guess I could describe it. And if we've got a joint that's very tight and lacks range of movement, is we have to restore that range of movement to the joint. Now, many ways of doing that, things like massage, things like going to see a chiropractor or an osteopath, or just simple trigger pointing yourself. So, and even stretching as well. Stretching can be another good component of restoring range of movement at a joint. So, what we have to understand, number one, is we have to put the joint or the muscles or the ligaments or the tendons or the fascia around the joint back to some sort of normality. What that then does is that then allows us to restore the range of movement at the joint. Because, for instance, let's say we twisted an ankle. So what happens when we twist an ankle is our ankle joint will become very tight and there will be very limited movement whilst the swelling is there. So what our body's doing at that time is it's changing how it moves to protect the joint. Now when the ankle recovers, the range of movement at the ankle doesn't necessarily go back to its normal ranges, or it doesn't go back to its ranges that it had before the injury. It will keep some degree of the tightness around the joint and it will restrict that range of movement. What that can do, now if that happens at the ankle, the knee, the hip, the thoracic spine, the shoulder or the neck, that's going to restrict movement. Now that restricted movement creates a compensation in other joints. So for instance, if you twist your ankle, it will create a limp, but that can create an overuse of the opposing leg. So there becomes a compensation. Now as this compensation occurs and continues, it can create other muscular imbalances. And what can happen if we carry on this conversation of, things changing and compensating and things like that, what that can do is that can manifest in pain in another joint, i.e. the lower back. So from a twisted ankle, in 2-3 years time, we could start creating a lower back pain because of an injury 3 years before, because of all the compensations and different movement patterns that we've created in our body to compensate for the twisted ankle. So once we understand that's happening and we then start correcting the range of movement at the joint, so let's take our twisted ankle for example. So if we then start massaging and using a chiropractor or an osteopath, or we use stretches or whatever to restore the range of movement to the ankle, that gives us a window of opportunity to restore the correct movement. Because when we get that twisted ankle, we change the way we walk. And obviously, when we change the way we walk, that creates compensation, goes up into the lower back, causes lower back pain. So what we have to do is we have to, number one, restore the joint back to some degree of normality, or we have to begin that process. It's not going to happen in one session with a chiropractor or an osteopath or a physio or one lot of stretching. It's going to take a progressive amount of time. So what we have to do, number one, is we have to restore the ligaments, the tendons, the muscles, the fascia back to some degree of normality. That gives us a window of opportunity, and in that window of opportunity we have to learn how to move again, or we have to learn how to move properly again. Okay, and I'm going to talk a little bit more about that in video number 2. So yeah, click through and watch the next video.